to the patient. Before I do anything, I ensure that the scene is safe, and once I've found that the scene is safe, I'll come up to the patient and I'll determine the mechanism of injury. In this case, the patient got in a car accident. There's only one patient, and if there's anything seriously wrong with him, I will make a call for other EMS support. If the injuries are that bad, I will check his spine and make sure nothing is out of place there. If so, I'll do the proper steps to make sure that he doesn't move and his spine stays stable. In the primary assessment, I will get a general impression of the patient. It appears that the patient has a broken ankle and he has broken ribs. He's complaining a lot about his ribs, so that's how I see that, and I see the ankle is broken. And the patient let me know that his chief complaints are his ribs and his ankle. I'll then assess the airway to see if the airway is clear. It appears that his respirations are not shallow and they're quick. So I will put a non-breather mask on him to assist with his breathing. I will then check his circulation and check his pulse and see how his pulse is. It may be a little increased due to the accident and he's a little nervous at the time, but for the most part he seems okay, so I'll check all of that. I'll assess his skin color. His skin color appears okay, however at his ankle and his ribs it is a little discolored, it is bruised, you can tell that there's broken bones involved. There's no external bleeding, so I won't have to worry about any external bleeding. However, there could potentially be internal bleeding, so I'll be sure to send this patient off as fast as we can to the hospital for reassessment. His GCS scale appears to be 15. However, we don't want to hold the patient any longer on the scene because he does have broken ribs. There is a potential for internal bleeding, so we want to get him to a hospital as quick as we can. I'll get a sample history from him if possible, which he should be able to give me a sample history because he has a GCS scale of 15. I'll assess his head, make sure that his mouth and his nose and his ears are okay. I'll assess his eyes to make sure his pupils are dilating the correct way. And I will also palpate the scalp as well to make sure that his head's alright as well. Next, I will check his neck and make sure that his trachea looks okay, as well as his jugular veins and his cervical spine, make sure everything's looking normal and doesn't hurt. I'll then inspect the chest and palpate the chest to see if anything hurts, and I'll listen to make sure that his heart rate is and his pulse is still beating the proper order. Then I'll come to the abdomen and I'll palpate the abdomen, see if anything hurts there. It obviously will, probably to a degree because his ribs are broken. However, we'll see if there's any other pains anywhere else. And I'll palpate his pelvis to see if he happened to break his pelvis or anything like that. And then I'll verbally ask him if anything's wrong, if his genitalia hurt or anything like that. In the lower extremities, I'll palpate and assess his motor skills. I'll feel his legs, see if anything hurts. I'll wiggle his toes, see if he can feel his toes. His ankle, it may be pretty bad, so I wouldn't want to hurt him in any way, but want to make sure that his motor skills are still there. I'll do the same for his arms, palpate his arms, touch his fingers, make sure all the motor skills are there as well. I'll check the posterior thorax, lumbar, and buttocks and make sure everything's going well there. I'll ask him if there's anything that hurts. For his vital signs, I'll then obtain a baseline vital signs, check his blood pressure, his pulse, and his respirations, make sure everything's normal and not anything's declining or increasing at any irregular rates. And then after, on the way to the hospital, I'll do a reassessment every 5 minutes because we're not sure if there's any internal bleeding, and if that's the case, we want to make sure to get that documented and let the hospital know so they're ready for him on arrival.